Good morning to those of you in the room and to those of you online. It's a very great pleasure for me to introduce our speaker today. Professor Valerie Tarasuk has been a long time and much valued colleague in the Faculty of Medicine, where she is appointed in the Department of Nutritional Sciences with a cross appointment in the Dalla Lana School of Public Health. Valerie obtained her first degree from Mount Allison University in mathematics and philosophy, followed by a B.Ed in elementary education from the University of Ottawa. Her career in nutritional sciences began with her receipt of a BASc in applied human nutrition from the University of Guelph, followed by a Master of Science and then a PhD, both in nutritional sciences from the University of Toronto. In 1994, she was appointed assistant professor in nutritional sciences and progressed through the ranks. Those of us from U of T will recognize that phrase. On July 1st this year, she became Professor Emerita after almost 3 years of exceptional scholarship in what I consider to be a public health crisis. Valerie's early work helped lay the foundation for food insecurity monitoring in Canada. In recent years, her research has utilized monitoring data to advance knowledge on food security in this country. She and her colleagues have made good on the opportunities afforded by the linkage of food insecurity monitoring data with health administrative records to conduct studies to delineate the healthcare utilization patterns and healthcare costs associated with food insecurity and elucidate its relationships to morbidity and premature mortality. Their work has also advanced our understanding of possible interventions. Valerie's work has helped to propel food insecurity onto the federal policy agenda, and it is now an integral component of the National Food Policy and Poverty Reduction Strategy. Valerie's innovative and outstanding scholarship has been recognized by the awarding of 2 visiting professorships, one at Memorial University and the other at the University of Calgary. She is the recipient of 2 honorary degrees, one from Queen's University in 2018 and the other this year from the University of Guelph. She holds the distinction of Fellow in the Canadian Nutrition Society, and her graduate teaching and mentorship has been recognized by a Continuing Excellence Award from the University of Toronto. Now, 2 pieces of good news. First, Valerie may have officially retired, but she's not stopped working on food security issues. When I corresponded with her last week for her CV, she was in the midst of completing an application for continuing research funding with respect to proof, which she'll be telling us about quite shortly. So her contributions will continue to push the policy envelope on food security for some time to come. Secondly, and closer to home with respect to Senior College, Valerie has told me that she intends to apply to become a fellow of Senior College. Valerie, I'm delighted that you've agreed to talk to us today, and I look forward to having you a colleague again, this time in Senior College. So on to you.
Mary Jane, thank you for that introduction. That's very kind of you. And thank you for the opportunity to talk here today. So as you'll see as we go, I should start with my disclosures. Can I?
Oh, just quick comment and then it'll work.
Okay, yeah, got it. So what I'll do in this talk is give you an overview of what we've come to understand about food insecurity. But I've titled this the Public Policy Blind Spot because, as you'll see, we've got a mess on our hands. So first, a definition, because these are terms that are used in a bunch of different ways. When I use the term household food insecurity or food insecurity, I'm talking about inadequate or insecure access to financial constraints. So it's a very specific problem, right? People struggling to afford the food that they need. The popular image of this thing is food banks. They are the public face of food insecurity and very much continue to shape a lot of what goes on related to this problem. Okay, so as I was preparing this talk, I was thinking one of the things that is kind of neat about talking to senior college is I think most of you can probably remember a time when we didn't have food banks, right? Yeah. See, I rarely get the luxury of talking to an audience with that memory, right? I mean, think about it. Generations now are growing up who just assume it was always the case. But it matters a lot that that's where this all began. So through the 80s and 90s, we saw a very rapid proliferation of food banks in Canada. And they were, I'll talk more about them through this presentation. They were modeled after an initiative in the United States. And they very much set the stage for everything that has happened in relationship to food insecurity since. So in 1981, the first food bank was established in Edmonton. And by 1987, there was a meeting in Toronto where an association was formed. So these were ad hoc voluntary organizations, but there were so many of them. By 1987, they decided to band together in an association. In 1989, they did a survey of their membership and they called it the hunger count. So a survey of who was using food banks and how many there were. And that was the beginning of counting the problem. And then there was a lull because there were some changes in the organization, but food banks continued to flourish. And in 1997, they then went back to doing annual hunger counts, and they've done them ever since. So this is the context, okay? And so for decades, we've seen these reports by Food Banks Canada, the national association that used to be called Canadian Association of Food Banks. And what are they doing? They're telling us over and over again that we've got a big problem of hunger. Often, so they're doing a head count of the people using food banks. It's a big problem, and then they're possibly making policy recommendations. So the reports follow a very similar pattern. So if I go back to this slide, so in 1994 was the first time that there was a question about food insecurity that appeared on a national population health survey. And it was a question about child hunger. It was a horrible question, like how often, has your child ever gone hungry because you didn't have food or money for food? And how often has that happened? And what did you do about it? But the motivation for that question back in 1994 was to understand what was going on with this phenomenon in the communities across this country, where there were these constant reports of hunger and, appeals for donations to food banks. And what did it mean? What was going on? So that was the beginning. And then over the next decade, there were indicator questions that appeared on pretty well every population health survey that ran during that period. And finally, in 2005, Health Canada committed to monitoring. And in 2005, we started actually asking the same questions repeatedly. That was a big breakthrough because that decade between, every new survey had a slightly different set of questions, so you could never compare them. But the context for all of this was food banks and trying to understand what is the problem that they were indicating, and how big was that problem and how serious was it? Okay. So there were three things that emerged from that research, and they emerged right back in 1994 when that first survey was run. And what did we learn? As soon as we started measuring this problem on population surveys, we learned three things. First of all, that it was way, way bigger than the problem that was being represented by these hunger counts. The difference was 4 or 5-fold. And I'll show you some data on that as this presentation transpires. And it was more diverse. It was affecting a much more diverse spectrum of people in our population than the people who use food banks. And in particular, we were not noticing from the food bank numbers the number of people in the workforce that were struggling. The third finding, and for me, it's almost as important as the first one, is that the problem was way more serious. The presentation of food insecurity that comes through the appeals for donations is an emergency, a short-term, lacking of food, and you can fix it by giving food. And what you'll see as I show you some of the work we've done using health administrative records, this is a much, much more serious problem than that. Okay. Since 2005, we've been measuring food insecurity using an 18-item module that was developed in the 90s by the United States Department of Agriculture to monitor food insecurity in that country. And I'm showing you a summary here of the questions on that module. And because I want to impress upon you, I guess, just how bad the problem is that's being measured. The questions ranged from, do you ever worry about not having enough food and not having money for more? Through to relying on a few low-cost foods because you can't afford more, not being able to serve yourself or your children balanced meals because of a lack of money for food. But the majority of the questions are questions about quantitative deprivation. So skipping meals, cutting the size of meals, going hungry without eating, losing weight because of an inability to afford food, and at its most extreme, going whole days. Question number 18 on this scale is, has your child ever gone whole days without eating because of a lack of food or money for food? And then always the question after that is, and if yes, how often? The questions are trapping the problem, the experience over a 12-month period. They differentiate between the experiences of adults and children because of a very disturbing body of research that shows when families are struggling to manage with scarce resources, adults will deprive themselves of food as a way to free up what they have for children. So we're much more likely to find reports of adults skipping meals or whatever than we are children in households. We scale this thing simply by counting the number of affirmatives. This module was developed using educational, what I think of as just a statistical arrangement that I think of as rooted in education, Roche modeling. It was designed to work like a ruler. So the more affirmatives, the more severe. So we count up the number of affirmatives, and that's where we get the scale at the bottom that ranges from food secure, having said no to everything, to severely food insecure, where you've said yes to enough questions that we have reason to believe that there were people who actually went without eating. Okay. Oops. Okay. How do we measure this thing? Well, there are two survey vehicles for it. Initially, it was put on the Canadian Community Health Survey, a very large nationally representative survey of about 130,000 households over a 2-year period, so very big. And that's the survey that we've used to link to administrative data. More recently, it has been added to the Canadian Income Survey. Again, we're talking very, very large samples, and this is annual. Both of these things are administered by Statistics Canada. This is what our results look like for the 4 years of data we have from the Canadian Income Survey. It's a mess. In CIS 2021, which are people interviewed in the first 6 months of 2022, we're talking about 18.4% of Canadians living in a household that reported yes to at least one of those questions. That translates into 6.9 million. It's an increase of more than 1 million from the year before. And that increase is mostly made up of families with children. So this problem is huge. And what you can see is it's fairly flat, right? Until we move up. Like we could talk about the difference between 16.8 and 15.9, but it's really trivial, right? We're sitting at a very high level, and what we've got now is a highly significant increase. Here's what it looks like across the provinces, and these are the same 4 years. And you can see fluctuation. Everybody has gone up in the most recent survey. Every province has increased. But look at this. Well, you can't see it very well. I'm sorry about the paleness of the font, but you can see provinces like Newfoundland and Labrador and Prince Edward Island, they're showing prevalences now of more than 20%. The one noteworthy exception in this picture is Quebec. Quebec has distinguished itself for quite a long time now in food insecurity monitoring, with a significantly lower rate of food insecurity than anywhere else in the country. But still, even in Quebec, the rate has increased in this past year. Unfortunately, food insecurity is more prevalent amongst families with children than families without children. And so this is the prevalence of children under the age of 18 living in food insecure environments. And it's huge, right? Nationally, we're talking about 1 in 4 children living in 2022 is data collection in a household with food insecurity. And even before that, the rates were still 1 in 5. Again, Quebec is lower, but again, you can see the increase. This is a problem that is racialized. The rates of food insecurity are much higher amongst people who identify as Black or Indigenous. And if we apply more elaborate statistics to these data, what we can see is even after taking into account other demographic factors that are associated with food insecurity, people who are Black or Indigenous are at substantially higher risk of being food insecure than others. As you can imagine, we're asking people about their ability to afford enough to eat, and their problems of food insecurity are anchored in their inability. So this is tightly associated with income. As income falls, the likelihood of food insecurity rises. But what you can also, and this graph is divided by the 3 levels of severity. So the dark bar here is severe food insecurity, and it's almost imperceptible as we get to higher incomes, but it rises sharply as we get further down. But look at what we're seeing here. Like, it's not a clean relationship with income at all, right? We can find people with incomes that are higher, but still are reporting food insecurity. And we can find people with low incomes who are not reporting food insecurity. So it's far from a one-to-one relationship. Income source also matters a lot in relationship to food insecurity. And I'll talk more about why we think that is. Here you see the same data that I just showed you, but now what we're doing is just grouping people according to their main source of household income. And we can see that in this particular year, 63% of households who were reliant on social assistance, so that would be general welfare programs, but also provincially administered disability support programs, 63% are food insecure. In the most recent wave of data, this rises to 70%. So to be on social assistance in most parts of the country is almost to be certain of being food insecure. At the far end are private pensions, and then we've got the spectrum in between. Okay, another way of talking about this, though, is the universe of households that are food insecure. And now, what are their income sources? And I show you this because I want to emphasize this big blue bar. I'm showing you data from 2021. So still we were picking up people who were out of work because we were traversing the pandemic in part, right? So you can see here people receiving COVID benefits, primarily CERB. But still, even during that period of disrupted employment, over half of households that are food insecure were relying on employment incomes. So this is very much a problem of working aged adults, and particularly people in the workforce. Who are those people? Well, they're who you'd expect: low-waged employment, precarious work, racialized workers, people with 1 job or maybe 2 part-time jobs, but trying to feed maybe 4 people or 5 people with those wages. Food insecurity is also tightly tied to housing circumstances. As you'd expect, people who are homeowners are much less likely to be food insecure than renters, and that's irrespective of income. But most food insecure households are renters. Home ownership is protective, but people with mortgages are vulnerable. And part of the increase that we've seen in this last year is associated with an increase amongst people who are holding mortgages, which makes sense, right? So to simplify, this is my end of the demographic conversation. If we take the universe of research in this topic, what have we got? Food insecurity, as it's measured and monitored in Canada, seems to be primarily a function of income and assets and expenses. Those are the 3 building blocks, but within each one of those, it's complicated, right? That the importance of income is not just the amount of income, but the stability of it. And the security of it. And our primary window right now into assets has been home ownership, because that's what's measured. But we can see very important differences where we'd find someone with low income, but who owns their home, so they're not food insecure. And then expenses, which I think is part of the story moving forward. Okay, why does it matter? It matters because food insecurity is a potent social determinant of health. Independent of other things like education and income and ethnicity or race, food insecurity predicts health across the gamut, across the life cycle, and just about every sort of health problem you can imagine is more prevalent amongst people living in food insecure situations. That's true for physical problems, physical health problems, mental health problems, infectious diseases, injuries, you name it. And I'll show you some of that data. The associations with health are unbelievable. And they persist. Everything I'm showing you in this list are things that have come from multivariable analysis that have adjusted for other determinants of health. As you'd expect, food insecurity is a marker of poor diet quality. And people who are clearly, who are struggling to afford the food they need are making less healthful food selections. They're relying more heavily on processed foods. They are more likely to have dietary intakes that suggest inadequate nutrients relative to requirements. I'll give you a little illustration of that. This is the proportion of energy coming from ultra processed foods. So that is the new buzz in nutrition, is the bad thing, right? Ultra processed foods. And I'm showing you this. The bars are divided by age and for adults and by sex. And the 4 bars are showing us food secure, marginally insecure, moderately insecure, and severely food insecure. And I'm showing you this because at a glance, you can see they're not that different, right? First, if we play around, as of course we would, and adjust for other characteristics that are known to associate with dietary quality, we can get a significant trend whereby the more severe the food insecurity, the greater the percentage of energy coming from ultra processed foods. But we have to do a fair bit of fancy footwork to see this. It's not like to be food insecure is to have a terrible diet, and to be food insecure is to have a good one. Not at all, right? Most Canadians have terrible diets, and it actually has nothing to do with their food insecurity status. Yes, we can pick up a little something here. But I'm flagging this for you because we start by talking about food insecurity, and you think we're talking about a food problem. And in the early days of research in this area, that's what we thought it was, right? It's no accident that I was doing this as a faculty member in nutritional sciences. We thought we had a nutrition story. But as time has passed, I at least have come to think we've got another story. As soon as we scratch the surface and ask, how are you doing in terms of other things, right? We identify someone as food insecure because they are having trouble affording the food they need. But as soon as we start to ask them about their ability to afford rent, utilities, telecommunications bills, prescription medications, they have trouble affording everything. Food doesn't exist in isolation. The food budget is part of the household budget. And as particularly someone who is severely food insecure, they are very likely not paying their rent. They're in a financial crisis. So I offer you this at this point because I think it helps to make sense out of the health relationships that we're seeing, that what we're getting when we measure food insecurity, we start by identifying a food problem. We're focused on food. But once we step back, we can see that there's all kinds of basic goods and services that are being compromised in these households. So food insecurity has emerged as a potent social determinant of health because it's a very sensitive measure of pervasive material deprivation. It's an experience-based measure of material deprivation. Okay. Yes, it associates with diet-related health conditions. What you're seeing here is work that was done by not our group, another group led by Laura Rosella in Dalla and this is taking OHIP data and looking at the diagnosis of diabetes, type 2 diabetes, starting with information about household food insecurity status and people who didn't have any indication of diabetes, and then following forward. And what you can see is, as time passes, the likelihood of an adult in a moderately or severely food insecure household eventually manifesting with diabetes is very high. And that's true after we take into account other things. Now, different data set, a Canadian Community Health Survey, and these are self-reported mental health problems, but we've got a graded pattern again, whereby the more severe the household food insecurity, the more likely adults were to have reported a whole range of mental health outcomes, anything from the diagnosis of mood or anxiety disorder through to suicidal thoughts or major depressive episodes. Everything is more prevalent amongst those who are in the severely food insecure circumstances. And look at the scale. As we get to some of these, we're talking 40% of adults in severely food insecure households reporting those experiences. If we look at reports of diagnosis of chronic conditions, again, the mental health story pops out, but what you can see is a range of chronic conditions. Almost all of them are more prevalent amongst adults in more severely food insecure households. And in most cases, we have a graded relationship whereby the more severe the household food insecurity, the greater the probability that the adult will have reported having been diagnosed with that condition. The only one that doesn't move like a soldier here is hypertension. Everything else is sliding, right? Okay, that connects us to healthcare utilization, because chronic conditions in the context of food insecurity are hard to manage. And so when we've looked at a few different databases now to look at hospitalization, acute care use, and what we can see is what you would expect. People who are from food insecure households are more likely to turn up in acute care. They're more likely to be admitted. They have a higher odds of readmission. When they are admitted, they stay longer and they cost more money. Now, I hope you can see this okay. You probably can't. We opened up that data set to say, well, what are they being admitted for? What are they being treated for? Why are they in hospital in the first place? And where are the differences? And the little stars here show you that most things are significant. The only condition that we continually find is not associated with food insecurity in terms of healthcare use is cancers. But we pick up effects for pretty well everything else. And here you can see the very, very strong relationship with mental health disorders. We also have linked the Canadian Community Health Survey to the Canadian Vital Statistics database, so looking at mortality, and we can see higher rates of premature mortality, and particularly for adults identified as severely food insecure. The increase in mortality, or the difference in mortality associated with severe food insecurity, is across the board with the sole exception of cancers. But what's interesting is where we get really strong differences between severely food insecure adults and others. And it's things you wouldn't necessarily have associated with this problem, right? Infectious diseases, parasitic diseases, unintentional injuries, and suicide. So what we're picking up is a subset of the Canadian population who's profoundly disadvantaged and vulnerable to all things, right? What does it look like in terms of cost? Well, we have one piece of work from Ontario, and unfortunately it is dated. This is a piece of work we published in 2015. And this is us taking information about household food insecurity status from the Canadian Community Health Survey, linking it to health administrative records in Ontario, and totaling up everything that anybody was doing. So over the course of a 12-month period, what does it look like? And you can see again the graded association, whereby the severely food insecure adult over a 12-month period is burning up more than double the healthcare dollars of the food secure adult in the province. And that's just over one 12-month period, and that's just one adult. We haven't even captured the whole household. And it doesn't matter which of these subcategories we look at, all of them are significantly different, except, I believe I'm right, except it might be home care services. There's one of them that isn't. So if you cared about this for no other reason, it would be because it costs the system money to have such a large population subsets experiencing these things. And at the bottom, we've done statistics. Once I showed this without the bottom part, and people were saying, don't you ever do statistics? And well, yeah, we do. We just don't present them that much. But even after we adjust for income and other things that you'd expect to be associated with healthcare utilization, knowing the household food insecurity status is telling us something important about the likelihood of using healthcare services and the cost associated with them. Okay. So I hope I've persuaded you that we have a problem. What are we doing about it? Well, our primary response is the thing that got us started on this in the first place. We continue our single biggest response to food insecurity in this country is the same as it was in 1981. It's food charity. So let's talk more about that. What are food banks? They are extra governmental. They're ad hoc. You and I could start a food bank after this meeting. We could just gather some food, maybe what's left over there, and we could do something, and we would be a food bank. And we do what worked for us, like what we had, and when we were available, we could do it. It's a charitable model of delivery. So, you take what you get. It's, the giver and the receiver. There's a very definite power dynamic associated with it. And it is heavily reliant on volunteer labor and donations. Most of the people who work in food banks are volunteers. Only a small fraction are paid. And most of the food that is distributed, even though you have the impression as just a member of the general public, you have the impression that most of the food that's donated that is distributed is food that's donated, like in those bins that you see in the stores and things. But actually, more than 80% of the food that's moving through the system is coming from food retail. And that is food that cannot be sold or that retailers choose not to sell, either because it's old or it's damaged in some way. So the vast majority of the system is industry donations. Where's government in all of this? Well, they've been involved from the beginning. Even though these are voluntary ad hoc operations, they're gigantic now, right? In the 90s, when the system first started going, provincial and territorial governments implemented what were called Good Samaritan laws. Those were laws that absolved corporate donors of liability for the health and safety of what they donated. And obviously laws that were intended to increase the donations to food banks. Since then, through the 2000s, early 2000s, we saw some provinces issuing tax credits to encourage or to offset donations from farmers. And as you can imagine, we've seen some provincial authorities getting involved in food safety training for volunteers in food banks, because this is food that has been taken off it's not covered by the same kinds of public health inspectors and the same kinds of checks and balances that appear around food that is in stores. And what we've seen more recently is some other kinds of investments. So I'll show you what I mean. In 2019, Canada launched a food policy, and this was seen as a huge thing by many people in the food sector. And it had a vision, and the vision is a very standard expression of food security. All people able to access sufficient amounts of safe, nutritious, culturally diverse foods. So a vision that absolutely is the antithesis of the experience of food insecurity. When that policy was announced, there was a federal budget. At that time, the finance minister was Bill Morneau. And here's how the local food infrastructure fund was described. So we've got a national policy, and they're recognizing that we have a problem of food insecurity. And so what do they offer us? Paul and Corinne operate a not-for-profit food bank in Hay River, Northwest Territories. They received generous donations of fresh raspberries from a local farmer during the growing season. But because of their limited freezer capacity, they are unable to preserve these donations for use in the winter months when fresh fruits are harder to obtain. So with the support from the new local food infrastructure fund, Paul and Corinne will be able to purchase additional freezers for their food bank to generate less food waste while addressing food insecurity in the local community with additional healthy, nutritious, and locally grown food options throughout the winter. Now think about this. Like Hay River, Northwest Territories. I mean, how many raspberries are they growing up there? And that they have a surplus of them. Let's start there. I mean, have you seen a Canadian raspberry in Toronto? Anyway, So but this is the big idea, right? This is public policy in 2019 with the distinguished Bill Morneau. And what have we got? A federal program to buy freezers for a freezer, like for a food bank in Hay River, to prevent those raspberries from going to waste. Okay, through the pandemic, the federal government was concerned about food insecurity rising as the economy shut down, and there were lots of reports of food banks having to close because of public health restrictions and things. And so what we saw through the pandemic was an absolutely unprecedented allocation of public monies. And coming mostly through the umbrella of the local food infrastructure, that vision, right? That we needed to enable communities to mobilize their resources to take food waste, food that would otherwise not be sold, and enable people who were struggling to afford food to gain access to that food. We had never seen this level of investment before, right? The purchase of that freezer in Hay River, that local food infrastructure fund was really quite a small amount of money. And note, it was buying the freezer, not paying for labor and not paying for food, right? There was an Auditor General's report that looked at the pandemic response as it related to food. And what they flagged is classic, that they did not know whether these initiatives had reduced food insecurity. There wasn't really any evidence to tell us that, right? Even though there had been hundreds of millions of dollars dumped through that period, there was actually no. The assumption was that the food was given away. There, it must have gone to people who needed it, but that what impact it had on the problem remains a question. That said, I think the infusion of cash probably coupled with the growing public awareness of the problem has caused this system to mushroom. At the end of 2021, we saw a report from a food recovery organization called Second Harvest, and they reported that we have 4 times more food charities in Canada than we do have grocery stores. And that was a one-off survey. Like I can't imagine that number has gone down since 2021, but it would be interesting to know where it sits now. Okay, how does it relate to food insecurity? Well, this might surprise you. The red bars are the bars I showed you earlier. Those are the numbers of people living in food insecure households in Canada based on the Canadian Income Survey. The blue bars are the number of visits to food banks during those years. So we have a huge issue just in terms of scale here, right? Fewer than 1/5 of, even if we assume that the blue bars include some people from the red bars, which we don't know, even if we assume they're, these people and these people are the same, we're talking about quite a big gap, eh? Okay, it gets worse. There's been studies, we've done studies, and other researchers in Canada have done studies to look at food bank users. And what do we know? We know that the likelihood of you being in, the likelihood of you being in the blue bar increases if you are severely food insecure. That using food banks as a strategy of last resort, they are stigmatized in an affluent society like ours. They're not nice. You only do it if you have to. So you're more likely to turn up in a food bank if you are severely food insecure. It's a strategy of desperation. But the act of going to a food bank to receive assistance doesn't render you food secure. So food banks are limited as to what they can give you, and whatever they're doing, they're not changing the underlying issues in your life that are causing you to not have enough money for food. So the receipt of a bag or two of food doesn't change that story, right? So we have this major, massive response that is deeply entrenched that we've had since the 80s, and it is miles from where we need it to be in terms of the bigger issue of food insecurity. Okay, what does move the needle on food insecurity? Well, we've done a whole lot of work to try to figure that out. And anytime anybody has been able to run a model using, these things are all very inferential. We're working with population health survey data for the most part. Anytime anybody's been able to model a change in public policy that associates with a change in the income supports, the financial supports for low-income people, we can see that they have a protective effect. And so what I've got here is a laundry list, or not a laundry list, I've got a summary of that research. And it's effectively the building blocks of our social safety net, right? The children's benefits, social assistance, minimum wage, income tax, welfare rates, employment insurance, and public pensions. Any one of those things, if we enrich it and it goes to low-income people, we will see that it decreases their risk of food insecurity. I'm going to show you two of them so that you get, so first the first discovery of this was us when we started in Proof monitoring food insecurity using national data. This is the rates of food insecurity in Newfoundland and Labrador. So Proof formed in 2011. We started making reports using national data to try to draw attention to this issue. And we made this graph. And we thought, what's going on here? The prevalence of food insecurity in Newfoundland and Labrador had dropped by 5.1 percentage points between these years. We've never seen a drop in food insecurity like that before or since. And nobody even knew. I mean, we were just putting together numbers and then looked at this and thought, wait a minute, what's going on here? Okay. Well, look at these years. What we figured out, that was a period when Newfoundland and Labrador were doing well economically. They had offshore oil and they, the economy was humming. But when we look at the unemployment rate, for example, in relationship to the food insecurity rates, they don't exactly parallel each other. The economy was humming in the early part of this picture, but not later on. Something else went on. In 2006, they started to roll out a poverty reduction strategy. And it was a very, very special thing. At that time, they had a premier called Danny Williams. And some of you might remember him. He was a Newfoundlander true and true. And he, and he was called Danny Millions, right? He was a rich Newfoundlander. But Danny Williams was absolutely devoted to improving the lives of Newfoundlanders. And so this poverty reduction strategy was designed to improve their lives and not just a shell game around some poverty number. So what we figured out as we played around with the data that we had access to was that we made this graph. The rates of food insecurity amongst people on social assistance through this period plummeted. And what was happening? So we started at 59.9. So meaning that 59.9% of households in Newfoundland and Labrador who reported receiving some income support from the province were food insecure at the beginning in 2007. By 2012, that number has dropped to 33%. They're all still poor by anybody's definition of the term, right? These are people for the most part on welfare, but their ability to feed themselves and their children has improved dramatically. What happened? Well, when that poverty reduction strategy played out, immediately they raised the support levels. They indexed them to inflation. They improved access to affordable housing. They improved access to a variety of health supports. They increased the low-income tax threshold, and they changed the earnings exemptions and liquid asset exemptions. So what that meant is if somebody was on social assistance and they were able to get some work, even if it was only a few hours, they could keep more of that money than they would have before, right? It wasn't being clawed back either by taxes or by some asset exemption. And what happened? Food insecurity dropped. When we looked back at the graph of the rates in the province, 44% of that reduction could be accounted for by the improvements in the lives of people on income support. So huge, right? Absolutely huge. So for me, it was eye-opening. It was our first kind of empirical proof that poverty reduction could make a difference, and a profound difference, right? Okay, but you see that bar is going up again. Here's what has happened since. Newfoundland and Labrador has one of the highest rates of food insecurity in the country right now. What happened? The government changed. The government changed, the economy changed, indexation of benefits stopped. Everything, all those gains that had been made through that 5-year period evaporated, and we're back to where we were. But from that little window, we've got a sense of what public policy can do. I guess I should have said this earlier. As much foresight as Danny Williams had, they didn't design that poverty reduction strategy with food insecurity in mind, right? They had no idea that this was going to have this impact. They weren't even paying attention to food insecurity. They were looking at measures of poverty. And in fact, the impact of the strategy on the measures of poverty was modest. Depending on which threshold of poverty you use, they hadn't even shown an effect. So they didn't have a clue about the story that we were telling until we arrived on the scene with our graphs and said, wait a minute. And by then, of course, it was too late. They already had unraveled their indexation. The government, Danny Williams has stepped down, and, you know, it was history. But, okay. Next example is seniors' pensions. So this is the age spectrum from 2021. And I offer it to you just to take your attention over here. The people in Canada with the lowest likelihood of food insecurity are seniors. And that has been true, again, for as long as we've been measuring food insecurity. The best thing you can be when it comes to household food insecurity status is old. And there are a few advantages, but this one is gigantic, right? So there have been a few studies done to try to understand how public pensions are working. And this is a bit complicated, but it's a fascinating study. This is work that was done by Lynn McIntyre and Herb Emery, who at that time were at the University of Calgary. And they took a selected sample of low-income unattached adults, drawing them from the Canadian Community Health Survey. So low income was defined as 20,000 or low or below. Unattached adults, so that there'd be no contamination of, you know, benefits from a spouse. And what you see here is the fitted probability of moderate or severe food insecurity. And along the bottom, we've got the age spectrum. So we start with people in their 55, 56, 57. What's their likelihood of food insecurity, and through to 70. Okay. Before 65, the main source of income for these people, they have incomes below 20,000. They're primarily on social assistance, or they've got low wage employment, but those are the main sources of income. As we get past 65, the main source of income now is seniors benefits. So particularly old age security and the guaranteed income supplement, because these people are very low income, right? Okay, and you see what's happening. Well, okay, I brought a decoration just to help you see it. At the point that they turn 65, the probability of food insecurity drops in half. Now, nothing else has changed except that now they are entitled, not just eligible for, but entitled to old age security and the guaranteed income supplement. If they were on welfare before 65, their income will have more than doubled. And their income is indexed to inflation. Most social assistance programs in this country, including our province, are not indexed. So if you think about this period that we're in right now, and that we've been in for a few years, where we can't seem to walk away from a news broadcast telling us about inflation of things like rent and food, you know, people on social assistance in most parts of the country are getting poorer each time those prices rise, but not when they hit 65. Okay, but there's a problem with this picture. The chances of them hitting 65 are rather low. You know, we've done that work on premature mortality, and someone who's severely food insecure has a significantly lower probability of even getting to 65 than the rest of us do. Okay, I'm going to wrap with some comments about the poverty reduction strategy. It was introduced in 2018. It was introduced at a time when Jean-Yves Duclos was the Minister of Employment and Social Development Canada. And Duclos, he's now, I can't remember what he is. They keep moving him around, but he was an economics professor, I believe, from Quebec, from Laval, maybe. Anyway, a brilliant, brilliant man. And when he arrived into politics, when Trudeau came in and was assigned to ESDC, it was a wonderful thing, right? And he was put in charge of this strategy. And so the strategy is really a thing of beauty. It had I'll blow this up. It started with the introduction of what they called the official poverty line, the market basket measure. So a way to monitor poverty. They needed that because they committed targets, right? They committed to reducing poverty by 20% by 2020 and 50% by 2030. And they set up a National Advisory Council and a number of other things to track their metrics. They had three pillars that this vision of poverty reduction is organized around. Dignity, which is defined as lifting Canadians out of poverty by ensuring basic needs are met. And food insecurity was included under that pillar as recognizing that it is an indication that basic needs are not being met. And then there were two other pillars, opportunity and inclusion, and resilience and security. So the other two pillars are more of Trudeau's middle class agenda, right? But with that, they started tracking. So that's how food insecurity came to be measured on the Canadian Income Survey. And the tracking has proved to be quite perplexing. Poverty has fallen dramatically. And so the Canadian government is now ahead of its schedule to reduce poverty in Canada. But you can see the tracking that's happening for the other indicators, including food insecurity, these red little arrows. Most of the other metrics that they're tracking are not moving in tandem with that poverty rate. And so we're at a little bit of a standstill. I think the assumption had been that whatever the measures were that would reduce poverty, as measured by the market basket measure, would bring up these other indicators as well. And that hasn't happened. The primary driver of the early drop in poverty was, or at least the government has attributed that to the Canada Child Benefit. The Canada Child Benefit was a signature act of the Liberal government when they came in. It replaced two other child benefits that the Conservatives had established. So it was introduced in 2016, and it is almost universal. More than 90% of families in Canada receive some money out of the Canada Child Benefit. It's graded so that the lower the income, the higher the benefit. But at its most extreme, the most somebody would be receiving, I think right now, is around $7,000 a year. And that's for a child under the age of 6. When your child has their 6th birthday, the amount of the benefit falls by about $1,000. So we did an analysis when it was first implemented to see if we could see an effect on food insecurity. What's tough about this benefit is it's very hard to figure out. It's very hard to figure out how much money people are really getting from the benefit, from the data that are available to us, and how much of it is new money. I don't think a lot of, there's a lot of hoopla about it, but I don't know how much of it was new. How much the lowest income people's incomes actually increased when that benefit came in, because we already had the National Child Supplement, whatever, and the Universal Child Care Benefit. Anyway, we saw no difference in food insecurity rates between the before and after of the introduction of that benefit. What we did find, though, was an effect on severe food insecurity. And what you're seeing here is a comparison of households without children and with children, pre and post the Canada Child Benefit. And when we look at the population overall, we don't see much of an effect. But when we look at low-income households, we can see a 1/3 drop in the likelihood of them being severely food insecure, which is great, right? What is it telling us? Give low-income families a bit more money, and if they can do it, they will minimize their likelihood of being severely food insecure, right? But still, we're talking here about a rate of 8.2%. And remember, severe food insecurity is people reporting that there are people in those households that haven't eaten, right? This is a very extreme level of deprivation. And it wasn't wiped out by a long shot. It was minimized or, reduced. So now, ratchet forward a few years, in 2022, our most recent data, we're looking at 1 in 4 families with children under the age of 18 who are living in a food insecure situation. How could this be made better? Well, if we were targeting the Canada Child Benefit to reduce food insecurity, we would give more money to the lowest income families, right? Over half of families that are in the bottom tier of the support levels for the Canada Child Benefit are food insecure. So if we cared about using this benefit to reduce food insecurity, we give them more money. We would also end the differential between children under 6 and children over 6. I think that the logic for that must have related to people's ideas about childcare and childcare costs, right? And this extra money would help pay for childcare. But if you think about a 17-year-old as opposed to a 3-year-old, that 17-year-old eats more, their clothes cost more, they need a bedroom. It makes no sense to make those benefits lower. The other thing that is a blank spot, I think, in the Canada Child Benefit is there's no adjustment for regional variation in costs of living. We have a very, very significant problem of food insecurity in Nunavut. And the rates of food insecurity, I mean, the data from the most recent surveys are not good. They're not representative, population representative, because they've had to migrate to online data collection. And that's a problem for Nunavut. But prior to that, we had rates of food insecurity in Nunavut of over 50%. So the idea that we've got a Canada Child Benefit that is not higher for them, even though there's ample evidence that food costs are higher there, is just craziness, right? So I offer it to you to say that we could make this better. The reason I don't think it looks particularly good right now is because I don't think we're trying to target these some of these programs to fix this problem. So I hope I'll stop here. I can talk more about my thoughts on the Canada Child Benefit. As you can tell, I can probably talk about it for the rest of the day. I hope I've persuaded you that food insecurity is a serious problem. It's a problem that's out of control. It's a potent social determinant of health. And it's not a problem that's being moved by our generosity as it relates to food charity. But moving the needle on this problem really requires more deliberate policy intervention. And that means policies that are targeted to this problem and evaluated against this outcome so that we're actually thinking through a benefit as opposed to an arbitrary income threshold, which seems to be where we've gotten locked. I'll stop there. I would welcome your comments. And that's it for